super excited to bring on a guest in our Provider Spotlight edition. Today's physician is going to be Dr. Gary Huang, who is located in San Francisco, California. Dr. Huang is a Bay Area native, and he's board certified in cardiovascular medicine as well as internal medicine and a number of different subspecialties that he's going to describe for us today. And Dr. Huang's team is premier in their field about options that keep our hearts healthy and improve your quality of life. So without further ado, I'd like to bring my guest from backstage, Dr. Gary Huang. Welcome, Dr. Huang. How are you?
Doing great. How are you?
Wonderful. Well, thanks for joining us today. I'm so glad to have you on. I've been so impressed in getting to connect with you at some of the local provider events and just hearing about all the good work that you and your team are doing in the community. And I'm just extremely excited to feature you. And I know topics about heart healthiness are hot topics against the Medicare community, which we work a lot with the Medicare patients, but just in general, just a really hot topic for our healthcare participants here. So tell me a little bit about your background and training. How did you get involved in becoming a physician? How did it all get started?
Very excited to be on. Thanks so much for having me. So I was raised in the East Bay in Piedmont, and I went to college at UC Berkeley after I graduated high school. And then I left for the East Coast for about 10 years afterwards for medical school at Albert Einstein College of Medicine in New York. Did residency at Boston University in Boston, and then cardiology fellowship at Stony Brook in New York. And then I did another year of advanced imaging training in cardiovascular medicine in Houston, Methodist in Houston. And then afterwards, I was an attending cardiologist with a specialty in cardiac imaging at University of Washington and at Harborview Medical Center in Seattle for 4 years. And I was actually the Echo Lab director at Harborview Medical Center for 2 years before I joined the Cardiovascular Medical Group in San Francisco this past year.
So,
great. Yeah,
so what brought you back? You just wanted to get back to the Bay Area for your family? You've been all over the place.
Yeah. It's mostly for family. My wife and I just had twins actually this past year, and we needed help, so my parents are nearby. So yeah.
Congratulations. Oh my goodness, twins. So how old are they now?
They're almost a year.
Oh my gosh. So actually you're more awake when you're at work, right? Because twins, that sounds like a lot of work. Well, welcome back to the Bay Area. I think it's definitely our gain to get you back with all the innovations that you bring. So welcome. Now, I'm sure you had a choice when you came back to town in terms of who you wanted to work with, right? There's all these premier facilities across the Bay Area. What made you choose aligning with the group that you did? And tell us a little bit about your decision.
Yeah, great question. So right out of training, I was in academics for 4 years. And that was great. I was able to do some research and, do some teaching. And I was looking for something here in California in which I could do kind of the similar things, but focus more on patient care, which is what I'm most passionate about. And when I met my colleagues at the Cardiovascular Medical Group, they were all just really welcoming, really nice, and also really at the top of their field. And so I knew, it wasn't really just a private practice in which I was alone. I had a team of, 7 other colleagues in which I can run things by and kind of come to a good decision on patient care. And I was able to kind of, not be involved with the bureaucracy in academics and, just focus on patient care, which I really love. And I could see more patients than I could in academics again. And yeah, it's been great so far.
Yeah, it sounds like a really good fit. And I love the idea of being able to collaborate with other practitioners, right? Because that's really how you learn. It's like, well, this is what I'm seeing. And you get the input of 8 physicians versus just one, right? So I feel like that's good for everybody in terms of education and outcomes and everything else. So that's awesome. I love it. So
yeah, group is great because we actually have a mix of kind of more senior members. There's 3 or 4 of us who are pretty senior, and they can mentor the 4 of us who are not, who are more, newer to cardiology. And so, yeah, it's been a great mix. And I've loved it so
I think it's perfect. It sounds ideal. So I love it. So, and your location is right in San Francisco. Where are you exactly located?
Great question. So we have 2 locations that we're mainly at. One is in Daly City, and one is in San Francisco. So it's 2250 Hay Street in San Francisco. So right to the east of Golden Gate Park.
Got it.
And the other one is in Daly City. But we do
Fantastic.
have privilege. Yeah. And we do have privileges in multiple hospitals in San Francisco, Seton Hospital in Daly City. We also see patients at CPMC, as well as St. Mary's and St. Francis are the two main ones that we're
Got
at.
it. That's wonderful. So it sounds like based on all that broad range of locations and hospitals that you work with, it makes you accessible for beneficiaries out there through many different plans. You obviously take Medicare. I know you work with several Medicare Advantage plans as well. So are you seeing patients across your practice of all different types of insurances?
Yes, basically every insurance, commercial, Medicare, Medicare Advantage, pretty much, almost every insurance.
So, Dr. Huang, I was thinking about what you said earlier, and you talked about your passion for patients, right? To be able to actually see the patients and not spending so much time behind the scenes, really interfacing with them and helping with the outcomes. And I always think about, well, why do people do what they do, right? Because I'm not sure you wake up and, you're twins. They probably don't know what they're going to do yet, right? And so, why the specific passion for cardiology? Was there anything that drew you to that specifically? How did you know?
Yeah, it's I was exposed to medicine early. My father was an acupuncturist, and my mother was a nurse. And so, just growing up, I was kind of really involved in kind of seeing their lifestyles, and also I was able to shadow my parents as well at times. And I really love the fact that they were able to treat the patients and heal them, as well as build a good rapport with them throughout many years. And then in college, I shadowed a surgeon who, again, was amazing at her job in terms of treating the patient, but also like her patients loved her because of her rapport with them.
Right.
So going into medical school and residency, I knew I wanted to do something in which I could have a lot of patient contact. So I did internal medicine, and I was considering just doing general internal medicine until I rotated through the CCU. Which is the ICU unit for cardiology, and I fell in love with it.
Let's talk about your Medicare coverage. SCAN Health Plan is for people with Medicare, and that's their sole focus. They're known for their award-winning service, and that's really what sets them apart. SCAN has the comprehensive all-in-one coverage you need, plus the extra benefits that might surprise you, and the exceptional service that you deserve. It's time for a better Medicare Advantage experience. To learn more about SCAN, please visit scanhealthplan.com or ask about SCAN from your local agent or broker. Thank you.
Cardiology only involves, typically the heart, but it interacts with every organ in the body. And cardiology is just, it's a high acuity, exciting, fast-paced field where every decision you make, could result in life or death. And it's just, really fun and exciting. While being also able to just interact with patients regularly. So
right. I feel your passion coming through the phone. And I feel like any patient that got to see you, Dr. Huang, is really got a blessing, especially our senior patients, because we're always recommending internists for primary care, right? Just somebody who's trained to treat the whole body. And so in your case, when they see you for specialty for care for cardiology, I feel like it's a real advantage to have you, because you're also trained to treat the whole body, right? So you're not just focusing just on the heart, you're seeing the whole person. Mm-hmm. I feel like that's a real asset to you in your practice.
Absolutely. Yeah.
Yeah. So tell me a little bit about the conditions you guys treat at your practice specifically. So just name off a few. I think a lot of times we think, just the heart, high blood pressure, those types of things, but what's the range of services that you provide?
Yeah, great question. So cardiology, especially for our private practice, we basically are involved with almost everything involved in the cardiovascular system. So, the most common is coronary artery disease. So patients with heart attacks, patients with heart failure, patients with valvular heart disease like aortic stenosis, mitral valve disease, arrhythmias like atrial fibrillation, and even peripheral artery disease. And in terms of diagnostic tests, we do pretty much the whole gamut. So treadmill stress tests, stress echocardiograms, nuclear stress tests, echocardiograms in general, and then cardiac CAT scans as well. And then procedures, we do coronary angiograms. And so if a patient has heart disease, we can put in stents. We can also do stents for their peripheral arteries. We can fix their aortic valves with TAVRs, and then pacemakers as well. And we put in defibrillators also. And lastly, echocardiograms. Yeah.
Absolutely. So, obviously some of the things you mentioned there were surgical, right? So I just think of, obviously in your practice, you are surgeons, you've got a broad range of services that you provide. But when I think of cardiac patients, I always think combo, right? So there's surgical, there's lifestyle, there's medication. Can you tell us a little bit about the treatment options or the combinations of treatments that seem to work for most of your patients?
Yeah. So treating cardiovascular patients involves a variety of things, as you mentioned. Obviously, we treat them with medications. So, for example, a patient with coronary artery disease, we would treat with aspirin, statins as well to lower their cholesterol. There's so many newer medications as well that we can give, like Repatha, Nexlizet, and other types of newer medications. And as I mentioned before, we can open up those arteries with stents as well. And patients oftentimes underestimate the lifestyle modification that we advise. So patients who, for example, are obese or who have really, really bad habits of not exercising, they're sedentary. I always tell patients that exercising and diet is at least as good as a heart pill, because not only are you improving your heart, but you're also improving your body in general, and then your mind and spirit. So
right. So it's touching all the angles. Well, that's what you get from your background, having the acupuncture and the nursing. They've trained you to do that, and then you're practiced in internal medicine. I feel like, again, the whole person, the mind, the body, everything is going to play a role. So, when I think of warning signs for the heart, right? I think, everybody has had that dramatic example where someone has chest pain and, has an emergency type situation, right? Mm-hmm. Then I'm sure you get a lot of referrals coming that way. But, are there more subtle warning signs that people should be paying attention to, to get a referral to cardiology or to talk to their doctor about it? What are kind of those subtle warning signs that people may or may not recognize?
Mm-hmm. So the questions that I basically ask every patient, there's a few of them, but the main ones are: do you have chest pain? Do you have trouble breathing? Any shortness of breath? Any palpitations? Any lightheadedness? Any loss of consciousness recently? And in particular, patients with cardiovascular disease in their coronary arteries oftentimes have chest pain or shortness of breath that worsen with exertion. So, for example, a patient who's able to walk usually like a few miles can walk, many flights of stairs, can only walk 2 flights of stairs now, or maybe even 2 blocks because of shortness of breath or chest pain. So that's when I would really be concerned for coronary artery disease. Patients with heart failure, for example, they might have, worsening shortness of breath as well, but shortness of breath that worsens when they lie down because of fluid buildup in the lungs. Also leg swelling because the blood just pools in their legs and their heart can't pump it out. And then lastly, patients with something like atrial fibrillation might have palpitations or lightheadedness if the heart rhythm's abnormal.
So if anyone were to be having some of these warning signs, is the best bet to go immediately to the emergency room, or is it better to call their doctor? Like, what's the first line of defense in these situations?
It depends. Great question. It depends on the severity of their symptoms. And, if you have classic chest pain, for example, left side of your chest, that is getting worse and worse, worsens with exertion, but it's 10 out of 10, then I would go to the ER. That's concerning for a heart attack.
Absolutely.
If it's something that, it's more progressive and kind of slower buildup, then I think, calling your doctor for a referral or seeing kind of an urgent cardiology visit without being an emergent visit to the ER would be appropriate.
Absolutely. That makes a ton of sense to me. So now we talked about you being board certified in internal medicine. That was your first stream, right? Then you fell in love with cardiac, right? And you went into cardiology and got board certified there. But I know you have a number of other board certifications. Would you mind talking us through your board certifications and what they all mean and what it means to patients?
Yeah. So, it can get pretty complicated. There's a variety of board certifications in cardiology, some invasive, some not. I am a non-invasive cardiologist, so I specialize in cardiac imaging and stress testing. And the ones I'm board certified in are echocardiography, nuclear cardiology, cardiac CT or CAT scans. And so echocardiography is basically an ultrasound of the heart. So it's a great modality to look for patients who have valvular heart disease. So again, as, for example, aortic stenosis or mitral valve disease, et cetera. And echoes are also really good at looking at heart structure and function. So patients with heart failure, echo would be the first modality I would go to. So I specialize in that. And then also second is nuclear cardiology. So that's a modality we use for stress testing. So patients in whom we're concerned for coronary artery disease, but we don't want to do an angiogram, which is invasive, we'll just do a stress test with a nuclear scan. And we're also going to actually install a PET scanner in our office soon. And that's more of, it allows for better imaging of the heart. And I think we should have that set up soon. And then lastly, cardiac CAT scan. So I'm sure most of you know, but it's just basically a CAT scan, but of your heart. And cardiac CT is kind of interesting because it allows us to look at the coronary arteries without having to go in there again with an angiogram.
That's amazing.
Yeah, so we can actually gate it, which means we kind of make sure the heart's not moving too much. And so we can see the coronary arteries directly. So looking for anything like calcium or any buildup of plaque in the coronary arteries, we can address that with medications or again with stents.
100%. So I was going to ask you, so this whole range of cardiac imaging, non-invasive that you do, is this relatively newer? Because I feel like in the past, like people would have an angioplasty, that would just be commonplace to help diagnose. So is this relatively newer and kind of more cutting edge?
Absolutely. Yeah. It's a very, the field isn't extremely new, but the fact that people are specializing in it and the imaging modalities have improved so much in the past couple of decades that, it's a newer field.
Yeah,
more or less.
that's great.
Especially, cardiac CT, especially, because
Right.
we can not having to go in there invasively with the risks involved. It's a huge deal.
That's amazing. In every way, that seems better, right? So I love it. So now for your group, do you do a lot of the non-invasive testing for all the practitioners, or do you have others that kind of hold the same role that you do?
We all do echocardiography. We all do stress testing. Myself and one other colleague, Dr. Khatri, we both are non-invasive specialists. So we're the only ones who read cardiac CTs and nuclear studies, but the other ones do most of the other
Got it. That makes perfect sense. And it was funny, you touched on it when you said you were going to get a new PET scan machine in the office, but I was thinking, do you offer these services in the office or do people have to go elsewhere? So it sounds like you try to keep most of it in-house.
Yes, we keep everything in-house with the exception of CT because that's radiology. So we work with radiologists at St. Mary's and St. Francis who do the CTs, and then we overread the cardiac portion of it, and the radiologists read the non-cardiac portion. So it's a great collaboration between us.
Great. That sounds amazing. So, well, tell me a little bit about Medicare patients. So all these different treatments that you have, do you find, and testing and so forth, do you find that Medicare is pretty good about covering them regardless of the insurance? Tell me a little bit about how that part works.
Yes. Medicare, we take Medicare for sure. And we take all Medicare patients basically. For some of the Medicare Advantage plans, which we see as well for sure, some of the prior authorization for testing could add some burden to our staff, but I mean, it's not a huge problem at all. We have a bunch of staff here who can help with that. So yeah, we see the whole gamut of Medicare patients.
Right. So it sounds like you figure out a way to make it work, and you're just a real popular practice across the board. So that's amazing. If a patient wanted to get a referral, is that as simple as just asking their primary care doctor and getting a referral over to you? Is that kind of how that works?
Yep, exactly. So these patients are either referred from local primary care doctors, mostly independent, also maybe even referred from friends and family. For standard Medicare patients, these patients can just call us without a referral, and we can see them, immediately. For Medicare Advantage patients, depending on the plans, they may need a referral to see us from their primary care doctor, but otherwise, but some of them may need a referral, but otherwise we see them. Yes.
Yeah. Well, I think it's very, very exciting that there's so many innovations, especially just hearing about the non-invasive parts that you can do, right? Because just moving that way from a diagnostic standpoint is just such a better health plan for people, where it saves on cost, it saves on risk, it just helps them have such better outcomes. So I'm feeling a lot of passion for the work you do. I can see why you are as well. So
Yeah.
do you have a website where people can reach you?
Yes. So it's kind of a work in progress right now. It'll launch fully by next month, but you can find our group, Cardiovascular Medical Group, at www.cvmg-sf.com. And that website will have all of our contact information. It will have a description of each of the cardiologists there, and the insurances we take, which is basically all of them, and the procedures we do, the diagnostic tests we do. So yeah, it's great.
Awesome. So you heard it here. Go to www.cvmg-sf.com. And Dr. Huang, if you were going to leave us with a little bit of advice, right? If you could say, if everybody would just have done this one or this two things to keep themselves heart healthy, what would you say?
So the one thing I touched on this before, but it's also from one of the podcasts that I listen to, is the heart.org podcast, and Dr. Mandrola. But he says something that I agree with completely, and that's, diet and exercise are one of the mainstays in treatment in cardiology. And a lot of patients and people just don't really see the importance of that. And so, it improves, again, the body, the mind, and the heart. And for patients with heart disease or without, we recommend at least 150 minutes of light to moderate exercise per week. So simple as half an hour of a walk in a park 5 days a week, after work, before work, that might save your life. And then with diet, if there's a plate of food, half of the plate should be vegetables, and cut down on carbohydrates and sweets, and salt as well. You don't have to cut everything out, but just in moderation.
Right.
So as long as you do those two things, it might save your life, and it's really important.
That's amazing advice, Dr. Huang. I just think about it. Diet and exercise. Will there ever be a talk that I have where people don't tell me diet and exercise is what I need to do?
That is funny.
Duly noted. But I really think it's been amazing having you on today. I really appreciate you joining and sharing with the Medicare beneficiaries out there all the amazing things you do. You met him here, everybody. Dr. Huang, he's part of the team in San Francisco. Let me pull it up here. It is Cardiovascular Medical Group at www.cvmg-sf.com. And I encourage you, if you're on straight Medicare and you need a cardiovascular visit and you're in the San Francisco area, contact them directly. If you're on a Medicare Advantage plan, like through Brown Toland Medical Group or one of the other participating groups, just be sure to get a referral from your primary care doctor. This is an amazing dynamic team of 8 practitioners that are collaborating with one another to ensure really good outcomes for all their cardio patients. So amazing passion. Dr. Huang being the spokesperson today. Thank you so much for joining. Have a great day, everybody.
Thank you.